Thank you. Thanks a lot, Madlena. And thanks a lot for asking me to guide this panel. So we have invited a couple of speakers for the panel, and especially as it has been mentioned that the aim of this project has been to develop some things for the sports clubs to work more on the health setting. And also as a good practice example of this project, that this has brought together like different areas as there are policy aspects, the policy documents at EU level, which have been the starting point of the project. Then on the other hand, it has brought together research part, a lot of universities and scientists involved, and then third, last but not least, like the practice part with sports associations being involved. So we wanted to include all these aspects in the panel discussion to further evaluate this Sport Club for Health approach from these different perspectives. As panelists, we have first Susanna Geidne from Örebro University. She's a doctor and senior lecturer in sports science there. And Susanna has also been involved in the Sports Clubs for Health project, so you know really well what the process has been behind this project. Then we have Felix Schäfer from European Olympic Committee's EU office. He's a policy officer there, and Felix has especially the approach of European umbrella organization as EOC, but also linking with the policy aspect as the EOC office works here in Brussels, bringing together the policies with the sports movement. Then we have Olivier Fontaine from the Sport Unit of European Commission, so policy officer as well. And Olivier is the expert in the Sport Unit who works with the HEPA topics and knows all these HEPA policy documents that we have heard of really well. So we'll bring some expertise from the policy point of view to the panel. And then we have Jean Gracia, Vice President of European Athletics Federation. And he's in charge of development there. And also we wanted to invite him to the panel to give the point of view of a federation, of a European federation, that how these sports clubs for health approach can be then implemented and applied in the federations. Okay, as a first question, I would want to ask Susanna, as you have been involved in this project, and especially you have been involved in the strengthening the scientific evidence base for the sports clubs for health programs, and worked in this work package. Were there some new scientific findings that you found for the evidence base of doing or being health or doing physical activity promoting health that you found during the project?
Yes, as mentioned briefly by Madlena before, we did a comparison across 6 countries on the contribution of sports clubs participants to physical activity among 11 to 15-year-olds. And we found that sports clubs is a large setting for 11 to 15-year-olds in all compared countries. It was around 2/3 that were participants to sports clubs. We also found that sports clubs participants reached both the MVPA and the VPA recommendations to a higher extent than non-sports clubs participants. But we also found, as also was mentioned before, that boys participate more to sports clubs and reach the recommendations to a higher extent, so more can be done to keep girls in sports clubs.
So then I guess like projects as we heard, the Irish example, like how it has also increased the girls' participation, so it's good practices, these kind of things where you have in practice this sports clubs for health approach, and can also, there was one of the findings was that it broadened the membership for different kind of participants. The next question to Olivier, we have heard already from Yves Le Lostec's presentation that there are several policy documents at EU level. The activity guidelines in the council recommendations, and this HEPA topic has been high on the agenda on the council work plans. So how, from Commission perspective, like as a policy or person who works with the policies, how you see this kind of project as the Sports Clubs for Health in the implementation of these policies, and especially the sports club setting for getting these policies into practice?
Yeah. Well, obviously, you don't expect me to say that the project is not important and was not successful. So, of course, the project is something very important, because at the end, at the level of the Commission, we can have 1,000 million documents, policy documents, recommendations, or guidelines. What matters is that these documents are implemented on the ground. And this is why this project is really something very useful, and we need multipliers like organizations that have been involved in the project to reach sport clubs, because at the level of the EU we are really far from clubs, so it's difficult really for us to reach clubs directly. Although we have means to reach clubs through Erasmus+. I could come back to that later. But we really need to rely on the layers that are between us and clubs, so municipalities, organizations, federations, associations. So definitely the Erasmus+ program and projects like this one are absolutely important to implement policy documents on the ground. And if I come back to this very specific project in particular, it was mentioned earlier, sport is one of the important sectors identified in the Council recommendation to address physical inactivity. And very concretely, member states are recommended to implement the Sports Club for Health guidelines. It's one of the 23 indicators. And that's very good, because the guidelines, as we have seen, are very good to support, encourage clubs to put in place health promotion. But then it really needs to happen and needs to be implemented. I can refer to the report from the Commission of last December on the implementation of the Council recommendation, which Yves Le Lostec talked about a bit earlier. If you look at this report, you will see that 7 countries have implemented the guidelines at national level. 2 more countries said they would do it in the near future, so that's 9 countries in total, which is good, which is promising, but we're not there yet, so we still need to work on that, and definitely these kinds of projects are very useful for that.
Thank you. I would then move on to Felix and take a bit the organized sport approach into the discussion. So also in this project there has been several federations or national, or it was led by Finnish Olympic Committee. So and it addresses the sports clubs at the grassroots level of the pyramid of organized sport. So Felix, coming from the European Olympic Committees, how do you see the sport club setting for this health approach? Many times it's thought, there's maybe thought more that it's for the competitive sports, this setting, and there's always the aim to get to top level. So what do you think? What are the advantages, and then on the other hand the possible challenges for HEPA work in the sports club setting and in the organized sport?
Well, I think some have already been shown, and I would like first of all to take the opportunity to congratulate the project team for the results and what was presented today. I think it's a good example of a project that has a cross-sectoral approach where you have the academic input and and the sport federations and also regional associations that actually implement it, and that's important because that's what makes it sustainable. And I think the examples we've seen, that's how this project will move on and live on. Looking at sport clubs, I think, and we've heard that they're a natural environment of people moving. That's the core of sport, making people move, and as such making everyone move, of all ages, from all social groups. What sport clubs offer is a framework for activity and for training. I mean, there are certified coaches that can ensure training that is properly done, that prevent overtraining, that adapt the training to a person's abilities. And I think that's as such already a healthy choice, because of course you can start running by yourself and that can be fine, but actually maybe you are really motivated and you want to do a lot more than you should, and that by a follow-up by a coach can help. On the other hand, it's a social environment, a club. And I mean, I think we all know the motivational aspects of that. If I know, oh well, I'll see my coach, I see my team, I see my friends, I'm a lot more likely to actually go and do sports. And that's the part that's important, and that actually gets me to be active. But the social environment actually has a health aspect in itself. I mean, we speak of physical activity and physical health, but we have to include mental health as such as well. And if we talk about aspects of loneliness or stress, I mean, these are things that in a social environment of a sport club can actually prevent it or help with. So I think there's something like this, and we saw in the Irish example also the point of personality development. I mean, that is something that's very healthy and that's good, so we should look at that. I think a sport club as such also is something that is reasonably accessible. I mean, normally the prices are lower than in commercial offers, and that is something that is important because it's an offer for everyone, and that's what we should aim for. And finally, and I think that's the part where the sport club really has the added value. It's sustainable. The sport club will not be finished after a campaign of a couple of months. It will not be gone after a single project, let's say, or whatever level that is, but it will be there afterwards. So the knowledge we have and we accrue, for example, in this project, it's there and it's being implemented. So I think that's important. That's something that we should use and yeah, work on.
Yeah, thank you, Felix, and you raised really well all these like physical, social, and mental aspects that has been also the outcomes of the project, that it has different levels of health and approaches. Then moving on to Jean, representing European Athletics Federation, which is really active in the HEPA or the health activities as well. So besides the competitive part, you also have a lot of activities to improve and encourage the health enhancing physical activity. So what do you do exactly, and why do you do this, and what are the benefits for you and your members of also doing the health aspects?
So first of all, let me thank you for the kind invitation here. I have enjoyed a lot the presentations that have been done until now. And what I would like to let you know is that European athletics, the athletics, it's much known today as a high-performance sport. Everybody knows what's happening during the Olympic Games, during World or European Championships. And to change the strategy of European athletics, which is now called a twin pillar strategy, with the high performance on one pillar and development on the second part, has been quite a difficult time. We started about 10 years ago, and we changed our slogan. Our slogan is Your Sports for Life, where we include, for sure, our DNA is a high performance. That is still the DNA and will remain the DNA, but more and more we absolutely need to push our member federations, because our members are not the clubs, are the member federations. Then the member federations have their members who are the clubs. So we have first to convince our member federations, that they have to move towards the second pillar, which is the sport for all, at all ages, all genders, for everybody, and also including all these health and well-being activities, as well as trying to do some things in the society, in today's society, where we have the sport and athletics in particular for my purpose. We have a very important role in the education of the young people. We have an important role in the day-to-day life of every individual, and we have the chance that athletics can be done at any age, so there is no limit, and this is important. So we are pushing our member federations to adopt this twin pillar strategy. I should say that some of them already started and are doing a good job. Some of us, it's much more complicated. We have 51 member federations in Europe, so it's not easy. The cultures are totally different in some cases. So we are doing that. And then we, for the ones who really want to work on that sense, we are helping them to create clubs or to work with the clubs when they have clubs. I am coming from the French Athletic Federation, where we have 2,200 clubs, and where we have started this thing also since some years, and where we see how much it is important to develop the health and well-being within the population, for the population, but also for the helping the club in the high performance. Today, the governments, the institutions have less and less money, or are much more difficult to provide subventions to the associations. Private sponsor is not so easy to get, so we need to find other ways. And by going to these health and well-being activities, we not only develop and help the population on that sense, but also we can have much more income to help also the development of the high performance.